Peace, everyone. This is Nafisa back with I didn't even show you my little logo thing here of what I'm calling this thing. So it's called the My Brother's Keeper.
Oh, nice. I like this.
Miniseries.
This is a good job.
Thanks. I'm really not that great with
That's
it.
excellent, though. Excellent.
Just to shed light on Mental Health Awareness Month, and next month is Men's Mental Health Awareness Month. So I've been interviewing a few people, again, just Black men from different backgrounds, different life experiences. Today we have Dr. Nii Darko. So I was going to have you introduce yourself, but I kind of just gave away your name. But if you'd like to introduce yourself, tell everyone a little bit about who you are and what you do.
Yeah, so I'm Dr. Nii Darko. I am a trauma surgeon. And I've been a trauma surgeon since 2012. And I also podcast. I have a podcast called Docs Outside the Box. And I am a proud husband. I'm a proud father of 2. I'm a proud brother of 3. And I am an uncle to many nieces and nephews, and possibly even a grandfather based off of some of the Ghanaian rules to some of my niece's kids. So I'm just kind of very fulfilled at this point in my life. So
nice, thank you. Definitely appreciate you taking the time out to do this. It's important for me to shed light on mental health, particularly in the Black community with Black men, because I know maybe perhaps in the society it's not, the thing to do to kind of open up about mental health or just anything involving feelings. So I definitely appreciate you taking a couple minutes out to do this today. My first question would just be, what has been maybe your first experience with or exposure to any type of mental health?
For me, you mean, or
just in general? If it started with you, like if your first introduction to any type of mental health was with yourself or with a loved one.
Yeah, I think for me, probably, at least for myself, I started noticing it, like mental health was an issue that I probably needed to address when I was in my mid 30s. So this is like, early 30s. So this is like, early 2008, 2009, 2010. I was in my surgical residency, which was in Georgia. Everybody in my family, including my girlfriend, everybody's in New York or New Jersey. So I felt really isolated, and I felt like a significant amount of stress of, being up early in the morning, being the last one to leave. My personality is very type A personality. So I think there was a little bit of some anxiety on top of that. And, I just found myself on numerous occasions, kind of suffering from imposter syndrome or kind of being under the feeling the heat of, like, at any time in my residency program, they can, let me go. Even though there's no evidence to show that, there was this drive, this chip on my shoulder that I think a lot of people use to kind of fuel them. But also at the same time, it's almost like a double-edged sword. Like, while it's pushing you to do things that you've never accomplished before, or maybe that you never could see yourself accomplishing, it actually is kind of eating you from the inside, because you're constantly being motivated by self-doubt or being motivated by other people doubting you, which is a very negative place to be. And I think that for me, that was like my first experience with anxiety, my first experience with just kind of realizing the stress of what I was dealing with. If you asked me that back then, I wouldn't be able to tell you the words now. I would just tell you, I'm just kind of stressed all the time, and I feel like I'm like always going to be fired or something like that, and that's it. Years later, now I can look back and say, okay,
that's what it was.
That's the issue. Snapping at people, particularly loved ones. You always end up snapping at people who you are closest to, just because they're there. And it wasn't until I got married, and even a couple of years after that I realized that I might have an issue with this. And probably about 4 years ago, I started to see a therapist. And there's a couple of issues with that. As a physician, when you're applying for a new license, one of the questions that they ask you is, do you suffer from any like depression? Do you suffer from any significant mental health issues? and they're not very specific about that. So there's this like common thing within the medical professional, particularly doctors realm, of you just don't say anything. Right. So a lot of folks are suffering from, depression, anxiety, like severe depression, anxiety, or some other things, but they prefer not to tell anybody about it because they're concerned that it will affect their job standing,
Right.
their ability to get a license. So they will pay for these things out of pocket, like getting counseling or maybe seeing a therapist or just seeing a psychiatrist. They'll pay for it out of pocket. So now it's a two-way struggle. You're now struggling because you want to make sure you maintain your license, and then now you're paying for things out of pocket because you don't want anybody else to know.
Wow.
So I've never gotten to that point, but several years ago I started seeing a therapist, and that's where I started to kind of learn that there's some things that have been, at least I thought were an issue like maybe a year before I saw a therapist. But then when you go back and you do the work, you're like, oh, this was back in the late 2000s I had this issue. So that's where I'm at with that. So that's my experience. Initially, I was very, very, I just kind of fought it off that I had an issue. I was like, it's just stress. But then, you start to realize that, a lot of this stuff is environment, a lot of this stuff is upbringing, a lot of this stuff is how we cope. And, I feel like I'm in a good place now, but it's always like something that I always have to think about. It's kind of like you watch those depression commercials. I don't know, you've seen those pharmaceutical commercials, and they'll show now, like, maybe they'll show somebody shopping, or they'll show somebody, moving through their daily life, and there's like a cartoon figure that's supposed to represent like the depression that's with them constantly. And I think that's the right way to show it. It's like you're never going to get rid of it, but it's just going to be this thing that is kind of with you, and you just have to know what the mental tricks are to keep it at bay. So with me and my anxiety, that's kind of how I look at it.
What was that point for you? Did something occur, or was it just like maybe you were just dealing with it for so long? It's like, okay, I need to. What made you say, okay, I need to see a therapist at this point?
Yeah, I think for me it was getting to the point where I couldn't control like the outbursts, the anger, the stress that I was having, and it just, people were noticing. Let's just leave it to you like that. Before, nobody would notice, or at least nobody told me what was going on. And once I started realizing people were noticing, that's when I was like, you know what, I may need to get some help to kind of just identify what the issue is, and then let's kind of just go from there. And it took a while. It took like about a year for me to kind of really understand where I was at. And I think ultimately, people look at therapy as, okay, well, it's going to be a quick fix. They're going to tell you what the issue is. And then it's like, it doesn't work that way
at all.
Because a lot of this is all self-directed work, so it took me a year to kind of figure out and identify what the issue was, and that I had it. And then,
was it hard for you to admit that? Like, okay.
Yeah, because you feel like this. I think initially there's this thought process of, okay, there's some type of defect.
Right.
There's a defect. And I think definitely within our community, you, first of all, as a male, you always feel like you're a provider. Right. And as a provider, you don't want to show any chinks in your armor. Then you throw on top of that the weathering from being a black male. You're just like, well, I deal with a whole bunch of different things as a man. Then I deal with a whole bunch of different things as a black male. And then when I come home, I'm supposed to be acting like, nothing is going on. And that's taxing, right? Same way as black women, they superwoman complex, or even the stuff what happens when they go, to work and stuff. Is just a constant barrage of things. So yeah, that's where I am at. So.
Okay. So do you feel like you ever had maybe the space or the support to vocalize some of the things that you were struggling with? Or do you feel like you had to keep up that, I don't want to say facade, but that image of being the provider with no chinks in his armor?
Well, I tell you, my wife made it very easy for me to kind of open up to her. She made it very easy. She's the one who suggested therapy. So I've been very lucky to have a very supportive member, a supportive spouse.
Right.
In terms of the rest of my family, I haven't really told them yet. I don't know if they'll see this, but now But it's just kind of one of those things where, it's just kind of like, I think with my family, I'm always like, well, I come from a family of warriors. So I'm just like, well, whatever situation I'm going to tell them about, I always want to make sure that I have plan A and B presented to them. Otherwise, I feel like they're just going to worry. And as you can tell, like, that's odd, right? And that worrying has come down to me because that's how I would want it, which is I have an issue and this is what we're going to do about it, and then kind of move on from there. So that's how I prefer to, like, let my family know what's going on, as opposed to just being like, yeah, I'm just going through therapy. Because I know they'll ask a whole bunch of questions. And I know with these, you don't have anything definitive. It's just something that I continue to do and work, and that's it.
So how do you feel like your upbringing and your cultural background has kind of impacted the way you view mental health? And maybe that shifted over the years, but how do you think that has kind of impacted your perspective?
Well, I definitely could look back and see that my family has that. Like, this stuff is within our family. You should never diagnose family members, and I have not. But I could just sit there and just kind of watch and look and be like, oh snap, you got the same issue. It's just that you are not ready, or you don't have that somebody who's with you to kind of just say, hey, there's this issue. But you can see like some of the superficial things that are like, oh yeah, like that's what I do, or that's where I got that from, or there's just maybe some issues in our family that we just kind of have, like, maybe there is some anxiety that's familiar, a familiar, what do you call it, hereditary version of it, where maybe mom and dad have it and now I have it, or maybe my sisters have it and then I also have it, but we all have it in some degree, so that's how I've looked at it. It hasn't really affected my childhood, or at least, I can't tell if it's affected my childhood because my childhood is already gone. But I can look back now and say, yeah, that was some issues on my parents' part, or that was some issues on my sister's part, and that stuff is still even relevant to this day.
Do you feel that you've grown more comfortable having maybe this kind of conversation with family members?
No.
And why is that?
I just haven't. I haven't gotten to that point yet, And that's me. That's not my family. That's a me issue. I just haven't gotten to that point yet.
So do you feel like, because a lot of times what comes up is that, and similar to what you were saying earlier about having to kind of just be strong all the time. And so this is kind of like maybe exposing, I don't even want to say an area of weakness, but a vulnerability rather. Is that part of the reason why you feel like maybe you're not ready to kind of have these kind of conversations?
Yeah. I think there's a portion of it that's related to my job. And then there's also that portion of, bro, you chose this, right? Like, so you kind of don't want to feel like, you don't want to feel like someone, like you need someone's help, or like there's a regret of going into something when everybody knew that's what you wanted to do from a kid. So it's kind of like, well, you wanted to do this. You told everybody about this. You watched TV shows around medicine, and you finally did it. And now you're saying that now you have some type of like anxiety, stress from that. We may not want to hear that. Nobody's ever told me that. Just so you guys know, nobody's ever told me that. But that's the mental stuff that occurs in my mind. And that's how strong that stuff is. Yeah. Right? Because lo and behold, like, I could just tell my parents right now, and they'd be like, oh, yeah, we understand.
So if no one's ever told you that, where do you think that message stemmed from?
Well, I think part of it is nobody talked about mental health, or nobody talked about that part of your health growing up. Nobody talked about that. And as a matter of fact, the kid in the 80s and early 90s, you would make jokes about people who have those things, right? You're like, what's wrong with you and stuff. When there's nothing wrong with you, it's just, it's just things are different. You look at things differently. So I think part of that is there is a silence, there's a taboo nature of discussing those type of things. And since it hasn't been brought up, there's a point where you or me I don't feel like there's like fertile ground to kind of have these conversations de novo, so to speak. Right. So you're just kind of like, maybe I need to tiptoe around this stuff. But there's no evidence that this conversation couldn't occur. It's kind of like imposter syndrome, right? Like, you feel like you can't do it. You feel like you're lucky. You feel like it's the program that got you through. You feel like everybody's questioning you. But when you ask the people that, they say, nobody's ever told me you that. Nobody's ever, it's just that internal thing that you have in your mind, which makes it so powerful and insidious, so.
And you do a very taxing job. So what do you feel like causes the most stress for you as it relates to your career being a trauma surgeon. Like, I don't know how anybody can just function day to day, you know, seeing some of the things that you've probably seen or experienced. And
yeah, you just kind of feel like you're walking on a tightrope, right? And particularly with trauma surgery, and I'm sure some of the other specialties like maybe neurosurgery and maybe even like the heart surgeons, the cardiothoracic surgeons, there's this constant feeling of any small mistake that you make will cause the person's death like instantly.
wow.
Right? Because that's how we, at least for me, like we have something called the golden hour, where someone is injured and you're not able to move or make some type of progress within an hour, like the statistics show that this person's not going to have a very good outcome.
Wow.
Right? So that's a very stressful time. That's a very stressful time to it's a stressful way to work, basically. But you get used to it, right? Like there's different things that you do. There's certain algorithms that we follow that give you that ability to kind of step away from like the acuity of someone possibly dying to, let me just make sure that I'm following this algorithm. And if I do it right, then I can feel okay. Right. So that's what we've kind of been taught to do, which is follow the algorithm, obviously take care of the patient. But if you follow that and things don't work out right, just know that you did all the right things. But at the end of the day, someone's still lost, a family member and so forth. So that's just kind of how, we work as trauma surgeons. It's a very stressful environment, but we have ways of coping.
Yeah, even as you're like sharing that, I'm like getting anxious for you because I can't imagine being in that position and what that could do to you, mentally and emotionally, being responsible for someone else's life at that point. So how do you cope with the anxiety or any other just stress in general? Wait, what are we playing?
This guy, Childish Gambino, I smoke. No, I'm joking. I'm teasing.
Well, you go to therapy. What else do you do?
But so the reason I have this picture here is not because I endorse smoking, right? I don't endorse smoking. But if you've seen the video, This Is America, like you could just see that he's dancing and he's doing these things. And there's a portion where like you could see like the stress of the day is so much that what he does, he just pops a cigarette and kind of moves on with his day. So it's not that I don't smoke at all and I don't encourage smoking, but it's like, I think we all can say, put that down. I think we all can say that, we've gotten to a moment like that where you almost like are at a break moment. In terms of what was the question again?
Just what do you do to cope with the anxiety and stress that you feel from day to day? What helps you?
Yeah, so what I started doing, I didn't realize this. I was doing this even before I started going to therapy. There's a point in a day where I have to get outside and I have to walk around the hospital or someplace. And the reason why is like, because of the position of what I do with trauma surgery, like we're kind of like almost like the garbage man, garbage woman of the hospital. Like we handle all the complications that are surgical and sometimes even non-surgical. People ask us so many questions and the ER is constantly calling and you're getting calls from other hospitals for people to transfer. So you get something that's real that's called decision fatigue, right? And after a while, there's a point where I just need to get out the hospital. I need to get fresh air, whether it's rain, if it's snowing, if it's cold, I don't care. I just need to get out and walk. And that helps to kind of bring the anxiety level down a bit. It offers perspective. Right. The world is still moving around, even though I feel like I'm in this small little microcosm called the hospital. But if I can get out, that's good. So that's the number one thing that I've been doing. I think the second thing that I do that's the most powerful of all those is I work out. And I'm now on my close to 3 years of just consistently working out about 5 to 6 days a week. And the reason why that is really important to me is what it does is it allows me to put things in perspective, right? So I do 12-hour shifts where basically I'm handling everything for 12 hours. And then after 12 hours, I'm off. I'm in my hotel room. And during that time, like I talk with my wife, I video chat with my kids. And because I work really far away from home. But the point of working out or exercising, obviously outside of the physiologic stuff of like, you're less stressed, you have less cortisol, you feel good. Right. There's that mental thing of no matter how bad it got at work, I still have time. I still have enough. I still have the effort to put into myself to make myself better, to
Right.
exercise. And that for me is like a great feeling. It basically says that there's no amount of stress that can stop me from at least making myself the center for like an hour or
Right,
two.
right.
That's been really powerful. Like, yeah, I don't have to make any decisions when I'm exercising.
Yeah.
Nobody's calling me. As a matter of fact, I don't accept any phone calls during that time. And the exercising that I'm doing, it's pre-made exercises that someone has already done for me. And I just
Right.
have to follow it. So in essence, it's like the anti of what I've done for 12 hours, which is I don't got to think about it.
Right.
It's quiet. Nobody's bothering me. And I'm just focusing on myself. And that is extremely therapeutic.
Wow.
Yeah.
Wow. So, I mean, you have 2 beautiful sons. What maybe messages surrounding mental health would you want them to know as you're raising them? What messages do you have for them?
You mind just
Yeah.
ask the question?
Can I use this for this?
That's fine. I think you guys can't see, but that one right there has some. The thing that I have to be careful of is not passing along, components of my anxiety onto my kids. I have to be really careful about that because I can see even to my 7-year-old that there's even some type A personalities, type A personality qualities that he has that I have to be very careful of. So the way in which I talk, the way in which I have my expectations, with homework, I have to make sure that when, we're doing homework together, he doesn't like to make mistakes. And I have to make sure I pause and make sure he understands that like things like practice makes perfect can be hurtful, right? Because yes, great, we have to keep practicing, but ultimately there's no such thing as perfect. And sometimes what I'll see is there might be a lack of effort on their part because they don't want to make mistakes.
Right.
Well, that's a perfection trying to kick in, or that's even some anxiety kicking in.
Yeah.
So that's why I try to encourage, like, look, we're going to make mistakes. You're going to make mistakes. I'm not going to yell. Mommy's not going to yell. But we're just going to keep practicing until, we get it right. And even then, when we get it right, there's still going to be some mistakes there.
Absolutely.
So I'm very cognizant now of like those type of messaging that I say to my kids. If they make like, even just things that, when you're trying to discipline your kid, like I have to make sure that I remember that he's not a robot or they're not robots.
Right,
I have
right.
to explain things for them so that they can understand it. And that kind of gives me a moment to kind of pause and not be so stringent, not treat them like robots, and really kind of appreciate each one for their own different type of personalities.
Absolutely.
Because the way how I parent one, it's a little bit different than how I parent the other. So that's been really, actually having kids has been the biggest, has been part of kind of decreasing my, my challenges with mental health, because it's kind of helped me to understand just how not perfect the world is.
Absolutely.
And as much as you try to want to control things, and I think pride, one thing is trying to control your kids because that offers you, a certain level of power that actually can make things worse. So with my kids, I'm very cognizant of those things and just try to, be a good dad, be a good husband, be a good example, but also realize that, ultimately it's their lives.
Yeah.
And the best I can do is kind of lead by example.
Absolutely. What about any advice that you have for maybe other young Black men out there, other residents or even future residents who are maybe interested in becoming a trauma surgeon? What advice do you have for them to maybe balance their mental health and their career or life and things in general?
I would definitely say that, this stuff is real. Like anxiety or an issue with mental illness is a very real issue. And just as much as attention that you would spend to, exercising or taking care of your physical health, you have to put the same amount of time with your mental health, because that stuff comes. It may not show up maybe in your teenage years, or it may not show up in your 20s, but it possibly could show up, when you start your career. It could show up in your late 30s, in your 40s, or sometimes in your 50s. So you have to be really cognizant of these things and realize that there may be some warning signs. And if you hear warning signs from family, or if you hear warning signs from people who are around you a lot, pay attention. If you feel like, I just need to talk to someone, it is okay. It is 2024.
Right.
If you need to get a therapist, or if you need some mental, somebody to help you with processing things, that is okay. You know, I think, you know, as someone I'm 45 now, like I'm old enough now to see life in like two phases, like from the 80s to 90s. Like nobody talked about this, right? You kind of only just thought about it as a rich white person problem, right?
Right.
And now in my second half, it's like, oh, wow, this is a lot more. It seems like things are a lot more liberal, you know, and everybody needs it, or everybody. It's more acceptable for everybody to get it. So if you're young and you're watching this, or if you're somebody who's on the fence, you know, I would oftentimes say, like, listen, like, first of all, you have to realize that this is okay how you feel. There's nothing wrong with you. It's not a defect or anything like that. And sometimes you may need some assistance, whether it's a therapist or somebody else you can talk to, who you trust, who's unbiased, who can give you some good advice or a good perspective. And then the other thing is just know that this takes time. Like, this is not going to be like a one shot. You meet someone like once or maybe 5 times and then that's it. It takes a lot of time. And even after that, just be prepared for all of the work, all of the issues. Like, that's all done by you. And I think that's one thing that a lot of people don't understand.
Absolutely.
They're like, oh, well, I'll just go see a therapist and I'll get right. And it's like, nah, like they're going to help point
They
you.
come in like, fix me. I'm like, yeah, it doesn't work like that.
Yeah, they come in, they help you, and then they point you in the right direction. And then you drive the ship. And then how you respond will let them know if you're actually doing right. I didn't know that. I thought they were like, oh, yeah, I do the stop technique. And they're like, no, you haven't, because I can tell by your interactions. Like, well, how do you know? I just know. And it is not until like several months of certain types of interactions, and when you describe it to them, they can say, yeah, okay, now you're practicing this technique right. And I was like, oh, wow, I didn't know that they can tell. You know?
That's funny.
Yeah, it's the truth, right? Am I lying? You know, so it's okay. You know, I think that it's okay to have that as a part of your life. You don't have to tell everybody. You don't have to broadcast it. But just know that it's something that, you know, we all deal with in certain ways.
Definitely.
Yeah. So,
is there anything else that you'd want to share, or kind of any last remarks before we wrap this up?
I think that you know, mental health is very important, particularly in our community. I think it's very important. You know, that's in more so than even physical. That's the ethos of who you are, right? Whether you believe in religion or you don't believe in religion, or you think it's something spiritual, like the whole metaphysical thing, in essence, is how you feel about yourself and how you feel where you belong in the space of things. That's extremely important. That gives you the confidence of who you are, the confidence to show up, the confidence to interact with everybody else. And if you feel like there's something that you want to work on, it is okay. And just as much as you want to work on physically being well or financially doing well, you got to put some attention towards how you are mentally also. And that is okay. So
that's the message. That is okay, essentially. So, well, I definitely appreciate you, honestly, like being open and transparent, you know, and just giving me the time to interview you and talk about mental health specifically within your career, but also with just you as an individual, who you are and what works for you. Hopefully someone will see this and really take heed to what you say about taking those walks or exercising or seeing someone, or will just feel okay with knowing that, okay, it's okay to see a therapist. It's okay to work on myself. So I really do appreciate it. At this point, we will close out.
okay.
And we will prepare for we will see you all next week with the following guests. Thank you, Dr. Nii Darko, for your time.
Thank you for giving me an opportunity, because I don't think you get a chance to see many Black doctors speak about it. So
absolutely.
Hopefully people will learn from my story. So
thank you. All right. Take care, everyone.